Hey everyone, my name is Mike, for those of you that don't know me. I'm going to go ahead and get started with this week's discussion for week 10. We are talking about the various healthcare practice models, and I have chosen to use Utah's professional practice model. And according to Porter, Cortese, Vazina, and Fitzpatrick, professional practice models are used to help improve patient experience in the care they receive and their quality of outcome. So I'm going to go ahead and introduce you to my patient. It is a volunteer that have gotten consent from both the parents, and her name is... What is your name?
Iris.
Hi, Miss Iris. How old are you?
Iris.
How old are you? Miss Iris thinks she is 1 year old. She's a little confused. She's actually a 70-year-old female. She looks good for her age. She eats a lot of yogurt that keeps her young. She's admitted for upper respiratory infection, cough, frequent falls, non-compliance as well. Has history of expressive aphasia. She knows what she wants to say, but it doesn't always come out the way she intends it to. She's also irritable and very non-compliant. Alert-oriented ×1. She knows her name. Her vitals are normal. She is incontinent of bowel and bladder. She uses diapers, also known as Depends or Briefs. She's ambulatory with standby assistance. Her diet is finger foods with regular chopped food along with ice cream, as we can see. Plan is to start Iris on antibiotics, teach her the importance of hand hygiene, physical therapy, occupational therapy, and speech therapy. In order to provide Miss Iris the best quality of care, we are going to be utilizing the Utah Professional Practice Model, and the model utilizes a tree system. So there's roots down here, and then there's different leaf components that make up the practice model. So I'm going to go ahead and go over each of the components. So for the root of the tree is compassionate, patient-centered care, and that includes compassion, which is empathy of care. It includes excellence, which is providing quality of care, and it also includes integrity, which is honest and moral care. The leaf components of the practice model, the first component of the leaf is to empower the patient to participate in her own care, and that will lead to wellness. So we will teach Miss Iris to utilize her own ADLs. So we will teach Iris to eat her ice cream. Can you eat your ice cream for us? Eat your ice cream?
Yeah.
All right, Miss Iris, we're going to teach you how to perform hygiene. Can you wash your hands, clean your hands with the napkin? Good job. That prevents infection, right? So you got to wash your hands before you eat, and then you got to clean the surfaces. Good job. All right. And are you able to pick up a spoon? Can you hold the spoon? Good job. And you're going to use the spoon to eat, right? Okay, so she knows how to perform her ADL, so we'll move on to the next subject. Next subject is voice, and with voice component, we are going to advocate for the patient's best wish and interests. So when Iris is having a lot of pain, if she's unable to tell me that she's in a lot of pain, me as a nurse or the provider, I can advocate for her by requesting pain medications, providing medications for her. So the next leaf component of the practice care model we're going to be utilizing is the collaborative team approach. We'll be using physical therapy, occupational therapy, dietary, and speech therapy. So the first part, as an example, is occupational therapy. Iris is utilizing Play-Doh to work on her hand dexterity skills. As we can see here, are you putting the Play-Doh back? Yeah. All right, we're going to work on your speech therapy. Can you say cow?
Cow.
Can you say horse? Can you say pig?
Pig.
As we can see, she's doing a pretty good job with her speech therapy. So we'll go ahead and move on to the next components of the leaf parts of the practice care model. The next one is courage, which means lead by example. So anything that I'm teaching to Iris or want her to do, I will also follow. So the next component of the professional practice model is to utilize evidence-based practice, safety, and quality measures to improve care. And this includes hand washing to prevent infection. It's best evidence-based practice to wash your hands, and it's been proven to show that it decreases infection rates. And also, Iris can keep up to date with her vaccines, prevent any type of viral infections such as measles and chickenpox, as well as other type of infections. The last component of the professional practice model is becoming a lifelong learner to help improve practice by conducting research. So being participants of research studies and keeping up to date with different research articles will help improve the facility's practice. All right, thank you. Say thank you.
Thank you.
Say bye.
Bye.
Say bye. Thanks for watching.
Do you like it?